The rest of you recognize that your bodies do the healing that the silver triggers. So all of it comes from here. With that stated, silver destroys bacteria, viruses, yeast, mold, and even the parasites that cause malaria. What antibiotic can come close to that? None. There is nothing that can come close to that. If you take 650 bacteria that cause diseases in humans, and you take the most broad-spectrum antibiotic like Cipro, and you put it in Petri dishes and kill everything in there, you know how many bacteria it will kill? 22 out of the 650. Oh, but that's a broad spectrum. That is our best antibiotic. What do we do with all the other 628 pathogens? Well, we usually die from them. And we laugh about it until we hear the word E. coli, or until we hear the word salmonella. Well, let's see, that's been in the news this week, am I right? Have 400 people? Pseudomonas, the plague. I can go on and on and on, and if we don't kill the bacteria, it kills us. So we have a natural way to do that. It's silver. Now, I'm here to talk specifically about women's issues. So I will, and I'll make a few jokes, and if I offend anybody, please know that it's just laughter, and that's the best medicine. So you can laugh at me or with me, and I hope you feel the same. With that stated, men that are here, we recognize that it's best for me to come and do a women's talk, because about 90% of all the silver is purchased by women, even though 60% of it is for men. And the guys laughing on the front row know that's true, am I right? Okay, so men, we're going to talk about you too, but I'm going to talk more specifically about women because women have issues that are not being dealt with by their doctors. That's unfair. That's prejudice. No, it's just something they don't want to do. Many of you know I've done videotapes that are training tapes for the OBGYN Association on infection control for women. So I have taken my experiences with my colleagues' experiences, and with the silver, we've learned to deal with the issues that women are not getting to deal with when they go to their doctor. Let me give you an example. And men, if you don't like the word vagina, just stare at the floor for the next 30 minutes. We're going to say it anyway. Laugh it up. I did a radio show and they named it Woman to Woman with Dr. Pedersen until they saw me sit down and they went, well, we can't change it now. So anyways, I've been granted a lot of women's issues in my life. This is a book that used to be this thick that's now only 75 pages. Why? In the last 5 years, something happened to society. We don't read anymore. We get 1-minute clips, and we get it off the internet. So we took those 1-minute clips, basically, and we talked to women directly about how to deal with these issues. Let me give you the example. Maybe you know somebody who went to the doctor, and she went in and said, I have a yeast infection, doctor, I need some help. This yeast infection was intravaginal, and she was itching and scratching and in a lot of pain and suffering, and the doctor says, oh, that's terrific. I've seen you for 13 seconds. Here's a prescription for something that will kill your yeast infection. And you get an antifungal drug. And you only get 2 pills now, right? Used to you could get like a whole, and now you only get 2 because they're so dangerous. And a couple of days later, now it's changed. And the pain is deeper inside, and it's now spotting blood too. Oh, dang, he gave me an antifungal drug. The problem with antifungal drugs is they make the bacteria grow. So into the doctor we go. Oh, here's a prescription for an antibacterial. Oh, here's an antibiotic. Okay, so you take the antibiotic every day, and all of a sudden, the yeast infection is back. And every 2 weeks, you go through this back and forth and back, and we'll take them together. Who knows? What happens is this. Antibiotics make yeast grow. Antifungal drugs make bacteria grow. And women don't know this because nobody taught them this because we've only had antibiotics for, 10 or 20 years in that category. So what is a woman going to do? Half of them just go away and suffer. And they don't do anything. And the problem gets worse. And then when it comes back, they get terms like endometriosis, or the whole lining of their uterus is now covered with a problem. And they have these problems that just go on day after week, after month, after year, because doctors don't really do that much down there anymore. You put your feet up in the stirrups, and they go, oh yeah, you've got that next. They walk out. They have lasers. They have ways to wash that area out. They have all these different tools, but nobody does it anymore. Doctors don't care about hygiene if they can write a prescription and walk away from it. Now, with that in mind, silver is a woman's best friend. And the reason why is because it destroys bacteria and yeast. And I got to tell you, the OBGYNs that come back to me and they email me and they write me letters and they meet me at the anti-aging conventions and they come up to me and they hug me. Doctors don't hug, right? Doctors hug me and say, my patients think I'm a god. They've been to doctor after doctor after doctor after doctor, but when you give them a tube of gel and it has silver in it and they put it down in there themselves and they take care of it without a diagnosis, and as soon as they itch, they take care of it and it's gone, that's good. That's prevention. But what they really are impressed with a doctor is when they've been to another doctor and they've received an antibiotic and then an antifungal and then an antibiotic and then an antifungal, and it goes on and they can't get it under control. And they give them a tube of this gel and say, drink 2 teaspoons of the liquid and use this gel 2 or 3 times a day. And in 24 hours, they're like, oh my gosh, I have control of my life back. Is it that dramatic? It's that dramatic. So, I've taken all the words that nobody dares to say, and I put them in this little 75-page booklet, and there's words that absolutely scare OBGYN doctors as much as they scare their patients. But we're giving you a recipe book on how to use the silver to deal with women's issues. Now, men, you might think, oh, this is only about women. Realize, the silver kills bacteria in you as well. And if I might have every man in the room look down at the ground and plug their ears for a minute, I just want to talk to the women for just for like 1 minute. I'll let you know. Notice no man's doing it. They're like, this is a secret I want to hear. All right, if you're listening, I'm going to be blunt with you, men. More than half of the time, the woman's problem was caused by you. Ooh. Most men don't agree. You guys are pretty spectacular. So, in this book, here's a table of contents. And the first chapter talks about dealing with the problem is bacterial infections of the vagina. Okay, there's one man here that told me he's going to count how many times I say the V word. He didn't dare say vagina, but that's twice for you. Anyways, so we have this infection. Then we have chlamydia. Do you realize that silver destroys sexually transmitted diseases? Wow. If there was no other reason than I was here, and I was speaking for the Public Health Association, or whatever you call it in Canada, and I were giving a lecture, I would say, instead of using KY jelly, which is a water-soluble gel and personal lubricant for sexual use, this silver is water-soluble lubricant with silver in it that kills bacteria, all of them, viruses, including HPV, human papillomavirus, yeast, and sexually transmitted diseases. Kills them all. Kills every one of them. So, you have a treatment and you have a prevention all in the same product. We talk about cramps, we talk about contamination, endometriosis, gonorrhea, herpes simplex, as well as another form, human papilloma. Let me stop on human papillomavirus. Who knows what that is? Human papillomavirus has been classified as a sexually transmitted disease, and that offends me. Because in America, the statistics are that 98% of all girls 18 old and younger have already contracted and have human papillomavirus. It is a virus that attaches to the cervix, which is the mouth of where the uterus opens, and it destroys the cells of the cervix until there's enough damage that the cells become abnormal and start to grow cancer. Yes, cervical cancer is caused by a virus. With that in mind, it takes about 2 years. But during the end of the first year, if you go to your doctor and they say, we're going to do a pap smear, and they go in there and they smear it and they say, you have some precancerous cells growing. Did you know in 5 days with silver, you can totally stop that and prevent any further growth and remove all of the abnormal cells and turn them back to normal? If my finger were a tampon and I squirted a daub of gel the size of a nickel on the top of it and inserted it when I went to bed tonight, I would be really stupid because I'm a man. But anyways, if I've got to find a better way to say that, don't I? There's got to be a better way. I know. There's got to be a much better way to say that. Okay, so the tampon with the gel inserted at bedtime, pulled out in the morning, again the next night, 200 out of 200 of my patients. 200 out of 200. All of them testing positive for HPV and abnormal cell growth. Totally in 5 days reversed it. Completely, totally reversed it. How come the medical world doesn't know about this? Silver is not in a position to be used as a prescription. So the pharmaceutical world is not going to use it and not going to allow it into the doctor's formulary. So that's why it's in this unique position. Now, I don't know why I got on that if I would thing. But if any of you have watched my videos, you've seen that Dr. Eaton and I, she's an OBGYN, we go through all the processes that teach the MDs how to use this. And at one point, she stopped me and goes, how could you possibly know that? You're not a woman. I'm interviewing her, right? And she's like questioning me now. Says, how could you possibly know that? You're not a woman. And I says, I've studied a lot. And she goes, well, on behalf of the OBGYN Association, I'm bequeathing you an honorary vagina. So with that, I've never had such an honor before. I don't know what kind of conventions I get to attend, but I want you to know that I have put a lot of time and effort into this, and I have a lot of stories that, oh my gosh, could I tell you stories? But here's one that's easy for you to understand. If you've got a daughter and she's getting HPV like every other girl is getting, and by 18, somewhere in there the doctor's going to say, oh, you're in here for the flu or a cold or stitches? Oh, while you're here, let me just give you an injection for HPV. Guess what? No is the answer. Why? We have the solution and cure. This is something I'm not that fond of changing DNA for, okay? So that's my advice on that issue. Going on, clap, clap, thank you. I'm so glad you agree with me. Going on, I see issues in women where they get control of their life and their life is filled with confidence. And the first way is if you have the gel and you know how to use it, and you have the liquid and you know how to use it, I know it's Canada, but you guys know more about our politics than half of our people do. It's kind of like Obamacare in a gel. You know what I mean? We should call it silver care. We really should. Because if you can start to feel a tickle in your throat, and it's so simple to just go and gargle or inhale some mist with this silver and have control through the night breathing the mist, and it's over in the morning, you wouldn't even have an appointment by then, and your infection would be 3 times worse. And the same thing goes for a vaginal infection, and the same thing goes for any infection, because moms are who treat their children. And the children come in with a green boogery nose in 2nd grade, and it doesn't ever go away. It just keeps coming back every month. What's that? Yeah, you're agreeing with me. Evergreen. I knew a tree named that, but I never heard a booger called that. That's good.
I'm sorry, every grade.
Oh, every grade. I thought she said evergreen. You just put me on a new line of thinking, and I so appreciate it. So in my world of women's discussions, they come to me and they've had that infection. And I know, I joke about it a little bit. It's not that funny. And I had a woman come up to me in church one time. And she put her hand on my shoulder and she says, could I talk to you? I'm like, oh, sure. And she took me outside. And I thought into the lobby was good enough. But no, we had to go outside so nobody would hear. And she says, I've had this problem. And she described a vaginal infection that she's had for 20 years or more. She says, I don't ever feel like having sex because I don't feel clean down there. I'm itching, I'm scratching, I'm burning. I've just learned to ignore it because I've been through every antibiotic you can imagine. We put her on the gel and said, how often would you like to use it? And she says, whenever it hurts. I said, that's fine. She came back and told me she put it on 10 times that day. And it was just fine by the next day. By church the next week, she had applied it fewer and fewer times because she needed it less and less. She came back to me and she gave me a big hug and took me outside on the porch again and says, I just want you to know that I don't have my problem anymore. And I was so happy, thank you, and I started to go back in, and she said for the next 20 minutes, described in detail every issue she'd had to deal with. And I hadn't heard all those things that had happened to her before. And that's terrific. Keep me informed. And I went back to church. And I'm in there 5-6 months later, and she comes up to me, and by now she's so happy and confident, and everything's moving on in her life in a great direction. She didn't need to take me out on the porch anymore. Instead, she just put her hand on my shoulder and said with everybody around that she didn't care. She says, I haven't had one of those green discharges in over 5 months. So, I know what this is to deal with more than you know. With that in mind, I've gathered many, many issues here, from skin and acne and the problems it causes. If you recognize that skin has little pores all through it, and those pores get filled with bacteria, and if they do, they grow bacteria in the pores and it causes acne. The cause of acne is a bacterial infection underneath the skin. We kill the bacteria that causes the disease. We don't just burn off your skin, dry it out, and do what other drugs do. So that's a terrific option. Imagine going on birth control pills for acne when you have access to the silver gel. And it's probably in your basement or in a drawer or in a bottle in the fridge. If you have that available to you, you can fix most everything. Here's an example. A lady came to me and she says she has the herpes virus on her lip. We call it fever blisters, cold sores, all those cankers, everybody wants to call it. It's a herpes virus. It's in her body from the chicken pox from years and years ago, or whatever virus was in her body, and up it comes in a little blister. In the lab, when I tested this, I found that when you put the gel on that little teeny blister, the second, and I don't mean an hour later, the second you feel a little pinch or a tingle, if you can get gel on there and keep it moist, so you'll take some gel, put it on, take some gel, put it on 5 minutes later, 10 minutes later, an hour later, you'll carry that tube around and you'll just keep that moist. If you can keep gel on that in the first 4 hours, that virus will never replicate. It'll go right back down, and not only will you stop it from erupting, it will go away today. It's not coming back very easily because you didn't let the mother cells multiply, and they die off. So what you're doing is you're not only stopping the symptom, you're stopping the cause. Now, if you wait 4 hours and the blisters come up and you finally get home and, oh, dang, I finally got my gel and now it's been 6 hours or 8 and you know it's going to come up, keep doing the same thing and it will heal in 1/3 the amount of time. Instead of 8 or 12 days, it'll be 2 or 3. It'll heal much quicker with less pain. So now you've got a situation where you have silver that works for women down here in all of their problems, even